Polycystic ovarian syndrome, or commonly known as PCOS, is one of the #1 endocrinopathies in the United States. It affects about 10% of the population. Its hallmarking symptoms are irregular periods and then androgen excess, so too much testosterone. That may lead to hair growth where we don't want it. It may lead to changes in the vulva and vagina that we don't want. And it also causes metabolic changes, so changes in our blood work. And that's how we evaluate polycystic ovarian syndrome. We also may do an ultrasound to look and see if a patient has the hallmark sign of polycystic ovaries, which are little tiny cysts around the rim of the ovary. There are some patients that don't have a lot of those features, and so we have to dig a little further about that. How does PCOS affect your sexual functioning? It's a chronic disease. So just like diabetes is a chronic disease, this is a chronic disease, and it can cause women to not feel good about themselves and therefore not really have the brain power or the bandwidth to connect with your partner. So the treatment of PCOS really involves a comprehensive approach. We are not just going to fix you with a medication. The biggest thing that patients need to do is they're going to have to change their diet. Because what PCOS really is an alteration in the metabolic system, or what's going on in the blood work, and they have too much glucose. So if we can get a patient to reduce their glucose intake, that oftentimes will resolve some of their PCOS symptoms. There are medications like birth control pills. There are some diabetes medications that we use in PCOS. My biggest concern about PCOS is the patient will go on to develop prediabetes, diabetes, and then cardiovascular disease. So we like to try to get them off that path so they can live a really healthy life. PCOS does play a role in fertility because what's the main thing going on? The main thing going on is the change in the blood glucose is causing changes in the ovary that prevent the woman from ovulating. When she doesn't ovulate, she doesn't get her period. And then as that glucose is stimulating the ovary, that leads to the release of excess testosterone, which then causes the hair changes, the acne, the oily skin, the things that they don't like. Diet is a major factor involved in polycystic ovarian syndrome. What's really going on is women were kind of dealt a genetic card. They didn't cause this, they were born with this. And as we get older and our hormones change, now the food that we take in really is going to impact our hormones. And so the problem is, as we take in more glucose, then that will lead to women developing the symptoms of polycystic ovarian syndrome. Acne, irregular periods, polycystic ovaries on ultrasound, hair where they don't want it, and then blood tests that reflect all of that.